So, welcome to the session. Uh, Before we get started, let me just set the context here. So, last year around this time, we had engaged with Cure International, which is a not-for-profit organization, and they are operating seven hospitals in Africa and one in the Philippines. They provide free of cost surgical treatment to children with curable diseases. And as part of this engagement, we built a new IPD capability into Bahmni, along with other enhancements to the product, like you'd see a new allergies module. We had also enhanced the appointments module and so on. But the main crux of the project was around the IPD, and that is what we will be demoing today. All right, so I think the recording is in progress, and we will get started. I'll share my screen. So I'll start from this landing page over here, where we already have a patient who has come in with complaints of severe stomach pain. Now I would go to clinical, and our patient for the day would be Asha Kumari. Now Asha has reported to the hospital with severe stomach pain, and at the emergencies ward, the nurse and the doctor present on duty would be examining this patient. And post that, the doctor would advise Asha to get admitted. So now let's start by recording the vitals of this patient. As a nurse, what I would do, I would capture the vitals over here. Uh, Let me just capture some values here. Let me put some of them out of the normal range. And I'll save this. Now, this is the nurse taking Asha's medical history. And what I would like to demo over here is the new allergies module. So when Asha is reporting to the hospital for the nurse first time, the nurse inquires about any allergies that Asha might be having. So now, how do we add allergies over here, right? On this allergies display control, we have a button called Add. Once we click on this, it is a side panel that opens up that allows us to capture the allergies. Now, in the first step, we would be searching for the allergen. Now, in this case, we can search through various permutation and combination. For example, if we know that, let's say, Asha is allergic to dairy products, right? I can search with dairy and then I would find the allergen. You would also see something in blue over here, which is the section of the allergen. Now let's see what happens if I search with food. So once I search by food, I would see all the allergens that are listed under food. Now same thing applies for, let's say, drug, right? I would say all the allergens that are under drug as well. And this list is configurable as well. We are using uh, a commonly used one, which we obtained from, if I'm not mistaken, from Seal, I think. So let's try to search for an allergen here. In this case, let's say Asha is allergen to insulin. Once I choose the allergen, I can also, search for the reactions. Now, if the reactions list are limited, we can easily scroll and, select some of them. For example, let's say skin rash, right? And then this comes as a chiclet over here. I also have a provision of searching for the allergen. Let's say, let me type in something else. And I can select multiple of this allergen against one, reaction against one allergen. I can also record the severity of this allergy. Let's say this is moderate, and I can also record any other comments. Let's say onset since 3 years. I'm just putting something random over here, and then I click on save. So for this patient, the allergen and the reactions and the severity would be recorded over here, and we can also see who has recorded. Right now, I'm using the super admin credentials, and we can also see the notes that were captured while adding the allergy. Uh, yeah, along with this, let's say in the emergency ward, right? The doctor is also advising Asha to get admitted. So what I'm doing over here, I'm going to this position and I'm clicking on the admit patient and I click on save. Now we'll move over to the IPD dashboard. But before I do that, just wanted to pause and check, are there any questions around allergies?
Hi, Abhinav. Um, is that the concept class associated with the allergies? How do we get the list populated? Or if we need to add something?
Yeah, so I think this list is configurable. Right now we are using a list which we obtained from Seal. But again, we can add concepts and then their relevant mappings to ICD-10 or any other coding system as well. It's a completely configurable list, Sandeep, if I answered that.
Okay. And I see something called other as in the type. So does it has anything that it allows you to type after you select other?
Right now, no, but what you can do, you can use the notes field over here to mention any of the other allergens that might be present.
No.
Yeah, but
That's
that's one of the enhancements that has been planned as well.
okay. Thank you.
All right. So, just summarizing this part, Asha has reported to the hospital, to the emergency ward. The nurse has captured the vitals, and the emergency doctor advised Asha to get admitted through the disposition tab. Now, let us go to the nurse journey, right? I'm using the bed management module over here. So once I'm in the bed management module, as usual, I would see certain cues over here, which says to admit, admitted, and so on, right? We have our patient over here, Asha, who was given a admission order. Let me go ahead and actually admit Asha. Let's admit Asha to general ward. And this was currently an OPD visit, but now I'm converting it to an IPD visit. And Asha has been admitted. Now, if you notice something, we have something called change to care view. And this is where our new IPD journey would start. So once I click on change to care view, this is this is the dashboard that would be used by nurses as well as nurse matrons. Now I'll talk about the fields that are present here, right? On the very first, we have the word that is selected. Now, we if there are multiple nurses, they would be, they can switch between the wards. For example, if there were patients under emergency ward, we would have seen them over here. Similarly, the case for pediatric ward, and we have our patients under general ward. Now, total we have 7 patients who are in the general ward, right? But we understand this might not be a realistic scenario. In a bigger hospital, there might be hundreds of patients, right? And it's not viable for the nurse to keep scrolling and search for the patients they want to care for. So this is where something called my patients come in. Now, how does this work, right? Let's say I'm a nurse and I'm concerned about caring for Asha. I can simply click on this, which allows me to bookmark, this patient. And I see that my patient, sorry, was there a question? Okay. So yeah, so once I click on here, this allows me to bookmark this patient and I see that the count for my patients has increased. Now, if I want a filtered view, I click on my patients and these are the patients out of, let's say, there might be hundreds of patients in the ward, right? But these are the patients with whom I'm concerned with. Now, talking about the next field, right? So what you see here, something called current period and the ability to navigate. So what this does, right now we are showing what is the next set of tasks for this patient. That is from 4 p.m. to 6 p.m., right? If I want to say what's after 6 for this patient, I'll click on here. And then if there were any tasks, that would have been displayed over here. Now, you might see that, against Asha, there are certain tasks that have been generated. So what are these, right? As soon as you admit the patient, we have the ability to configure and create, certain tasks for for the nurses. For example, very common scenario when a patient is admitted, the first thing the nurses would do is, take the patient history, record the patients, record the medications that are already being taken by the patients. So these are the tasks that are being generated by the system, and this list is entirely configurable. Depending upon the hospital and its use cases, we can configure as many different type of tasks we want. Uh, whether it's on the basis of admission of the patient, or uh, we can also configure them on the start of every shift. Now, talking about the search capabilities over here, right? We have the ability to search with the name of the patient. Let's say Asha. I don't have to type the entire name as well. I also can search with the bed number. Let's try 121. Sorry, 121, and I would find the same patient. And let's try with the patient identifier as well. So this is the patient identifier. Here again, I do not need to type in the entire identifier. Let me try a different patient this time. Let me try 008, 008, and I would find the same patient. Now, yeah, so these are my patients currently in the list. And I also have a filter capability over here. Right now it says all tasks. So what all tasks means over here is that, right, these are what we call non-medication tasks, since this is not related to administering any medication, right? Whereas, I think I don't have any medication tasks over here, but how we can use this filter, if I would have selected medication tasks only, I would see what is the next medication that is due for the patient. If I select non-medication, I would say only the non-medication task. By default, it is set to all tasks. We'll see how the medication task shows up as well over here on the screen. All right. So now, let me go inside the IPD dashboard of the specific patient. Let's say Asha. Now, this is how the new IPD dashboard looks like. At the top, we have the PII of the patient. We also have certain information like the address, contact details, and the relationship that will be coming in. Then we have something called the vitals and nutritional history. So if you remember, the nurse had actually captured the vitals of the patient, right? When the patient reported in the emergency section. So this is one instance where the vitals were captured. If the vitals on a daily basis, vitals would be captured multiple times, right? So here, we can expand and actually see how the patient has been progressing. For example, if I would have captured the vitals again, I would see how the temperature, has it been dropping or has it been increasing over the period of time and so on. Next, we had also captured the allergies. Now we have the ability to configure, sorry, is there a question, Bidar? Okay, all right. So, yeah, so coming back to allergies, right? We have the ability to configure, allergies to be shown in red. Now, we have the capability whether, we can show based on severity. Let's say the nurse is only interested in, allergies which are marked as moderate and high risk to be seen in red. We can do that as well. Uh, Coming below, we have the navigation over here. So let's say I wanted to go to diagnosis, right? All I need to do is click on the left-hand side navigation over here, and it would take me to diagnosis. Right now, we have not captured any diagnosis for the patient. Similarly, treatments. We have not prescribed any medication for the patient, and we will see how this functions when medications are prescribed. Coming to nursing tasks. So right now we have certain non-medication tasks that are generated for the patient. This is on the patient's admission. So if you remember, as soon as I admitted the patient, which was done at 4:42, there were certain tasks that were generated. Now, let's say I have already collected the patient history, right? I can toggle the switch and I can click on save. This gets marked as done. Now, let's say vitals was already recorded, so I'm skipping this task. When I'm skipping, this is again a configuration. We can make notes as mandatory. The nurse would have need to enter a reason why, they are skipping this. This is for safekeeping as well. Let me just put random notes over here. And yeah, record medications taken by patient. Let's just keep this one for now. What I want to also talk about is the shift over here. Right now, this is also another configuration that we have kept in. Right now, you see, we have shift timing from 8 a.m. to 7 p.m. Now, this is based on this particular instance, but depending upon hospitals, they can configure, different shifts. Once I click on the next, this is what the next shift would look like. I would see the tasks that were scheduled for the next shift, and I would also see a warning that, I'm not currently viewing the current shift. Uh, yeah, we'll talk about what these legends means over here once the doctor prescribes some medication. I also have a filter over here, right? Right now it is showing only the pending tasks. But if I want to see all the tasks that were done for this patient, I can do it on several bases. Let's say what were the completed tasks. So I know that I had completed this collect medical history, right? If I click on all tasks, it shows me what has been, skipped, what has been done, and what is still remaining. By default, I think we are keeping it as at pending. So this is where the nurse, focus really is on. Yes. Now going to the patient's dashboard, right? I'll talk about the links over here. Now, as a nurse, I had come in from the bed management module. So if I want to go back to the bed management module, I need to click on this button. It would take me back to where I came from. Now, why I'm mentioning this is because this button works differently for different users. So if a doctor would have navigated to the IPD dashboard from, when they click on that, it would have taken them back to the patient dashboard. I'll show how that works as well. Now let's go ahead and, create some medication for this patient. So I'm going to the patient's dashboard and I'll go inside medication. Let me type in the medication name over here. Okay, dose, let's say 1 units, frequency, let's say once a day, intravenous, duration 1, and let me also prescribe one more medication. So this is also 1 tablet once a day, but let's say this is for a duration of 5 days. And I'll click on add. Now, as a doctor, let me also, since this patient has severe, complaining of severe stomach pain, let me also put in some radiology order. Let me go to CT scan and order abdomen and pelvis examination. All right. Yeah, just to show how the diagnosis would show up in the dashboard, let me also capture a diagnosis over here. I'm just putting in random values. Okay. So as a doctor, right, if I want to go to the patient's IPD dashboard, I would anyways come to this page from the clinical dashboard and I can click on this link over here under visits. And this would take me to the patient's dashboard, IPD dashboards. Now, if I click here again, it brings me back to the landing page, the clinical landing page. Now, yeah, so as a doctor, I have now prescribed medication, right? Now it is the task of the nurse to schedule them. Now let's see how that works. I'll go to bed management and I'll go to care view again. So we have our patient here, Asha Kumari, and we see a notification over here. We see 2 new treatments, that is, 2 new medication has been prescribed for this patient, and we need to schedule them. Yeah, so we also see, the tasks that were completed, right? So we had collected the patient history. So this is marked as done, this is marked as skip, and this is still pending. Now let me go ahead and schedule this medication. So to do that, I can simply click on schedule treatment, and this will take me back to the same IPD dashboard. Let me click on treatments here. So we see that there are two new drugs which are prescribed by the doctor. And what I can do, I can click on add to drug chart. Once I do that, I see that all these fields are disabled since it is a prescription by the doctor and we don't want the nurse to be altering them, right? What the nurse can do is simply put in the start time. So right now it's 4:55. Let me put it as 5 p.m. Let's say this task is scheduled for 5 p.m. I can also add some notes here. Let me add something. And I click on save. Once that is done, right, I would see that, the light green color that you see here um, disappears from the first medication. We also see a nursing task being added over here that is scheduled for 5 p.m. And this is the drug chart, right? Where we see the name of the drug and also, a medication that is scheduled at 5 p.m. Here I can also see, the notes that were passed by the doctor. The first part is the one which is passed by the doctor while prescribing. The second one is while you're scheduling the medication. Now, before I go on to administer, let me also schedule this drug here, ibuprofen. For this, let me put it as a different shift time. Let me put it as 9 p.m. and I'll click on save. Right. So what happens? I see that this drug is scheduled on the drug chart as well. If I go over to 9 p.m., yeah, if I go over to 9 p.m., I would be able to see the drug as well. Right. And also on the nursing task, right? Right now, as I mentioned, it is showing from 8 a.m. to 7 p.m. So I see that the first medication is scheduled for 5 p.m. If I go to the next shift, I see that, okay, in the next shift, the nurse has to administer this medication over here. Let's also see how this looks over here, right? So yeah, so here I can see that this medication is scheduled for 5 p.m. And if I move towards later point, I think here we allow for a couple of hours only. But let's try to filter this. Let's say only medication tasks. In that case, it shows me only the medication tasks that are relevant for this patient. Anyways, let me go ahead and now administer the drug to the patient. To do that, this drug is scheduled for 5 p.m. All I need to do is simply click on this drug over here and I click on done. As soon as I click on done, I think it's again a configuration whether you want to make notes mandatory or not. Some hospitals they prefer making notes as mandatory for safety issues, but again it's up to the discretion of the hospital. So let me put something over here again, some note over here. This is also taking in the exact time that I am capturing this, and I click on save. Once I do that, again, the task disappears from here since by default, we are only showing the pending task. If you look into the drug chart, we see that, this is marked as completed. And I can also see the notes that were attached. Let's say the patient was, having adverse reaction. The nurse would have captured the notes in that instance, and this would have been displayed over here as well. All right. Yeah, I'll take a pause here. Just wanted to check if there are any questions.
Hi, Abhinav. Any does nursing has the power ability to administer any emergency drugs if they are not
Right,
prescribed?
right. Yeah. So that is the next part. So sometimes what might happen, right? In a realistic scenario, the medication was not prescribed by the doctor, but the patient had been showing adverse reaction. Most of the times, the nurse would call up the doctor, and the doctor would give a verbal order, right? Now, I'll demonstrate how that scenario is captured over here. Now, the nurse has this button over here, which is called Add Task. Once I click on it, I can choose whether to add a medication task or a non-medication task. In this case, let's consider it as a medication task, right? Let's say the nurse in emergency administered paracetamol 1 dose. Administered date is today and the time exactly right now. The nurse would have got a verbal confirmation from a doctor, right? Now, this is where the acknowledgement requested form comes in. So we can select, the name of the doctor who has given the verbal consent, and later we'll see how the doctor is notified of this as well. So once I do that and I click on save, I would say that, in the drug chart, the emergency medication is reflected as well. And I would see a different tag next to it. The tag would be emergency, whereas the others were RX. Sandeep, does that answer your question?
Yes.
All right. Yeah. So just wanted to mention here what we have done. We have added a emergency medication for the patient, right? But the nurse had also requested acknowledgement from a provider. So Rahul would also be demonstrating how, the provider is notified of the same and how they can acknowledge. Yeah. Rahul, you want to do that right
Can
now?
I ask one question before Rahul takes
Yeah.
it?
Yeah, sure.
So you said when the patient is admitted, the list of tasks are automatically added. Are those tasks like, and I know those tasks are configurable, but do we have the type of admission? Like sometime if the patient is admitted for the pre-op, like there's the planned surgery, and then there are the pre-op tasks has been given. But
Hmm.
patient who's admitted on an emergency, there are different kind of set of preparation. So is there, depending on certain, or like we had in the set order set, is there a kind of task set that can be added so that set of task gets added in a one go?
Right. Akhil, Anshu, do you want to take this question?
Yeah. So Sandeep, not yet. This is just the first version that we are shipping out. That is planned as part of the improvements. We do not have any tasks set yet.
Okay.
But we do create some automatic tasks which are generally done at every admission. Right. So that part is covered. But for now, you will have to add individual tasks. Uh,
Okay, thanks, Akhil.
You would have seen this on admission, a bunch of tasks got added.
yeah.
So we have taken that as one of the events. Now you can easily do this. For example, for everything that happens within a Bahmni in the context of an order or any consultation, an event is raised. So you can easily write a event listener in your OMOD or otherwise. You can see how we are doing it for, say, admission event, and create a bunch of tasks. Yeah, our only thing that we would ask you is that to make it configurable. Just like, we'll probably show you that how we can configure what tasks to be created on what sort of events. So implementers can implement it however way they want it, but just keep it flexible.
Yeah.
There's another question from John Pierre. So John, we can add, schedule non-medication tasks. So all of the procedure orders and everything would come under that. But like medications that, you get a direct link to schedule them. Right now, we do not have that capability. Uh, this will maybe come in future versions. Like I said, this is just the first version that we are shipping out.
Thanks, Akhil. Thanks, Anshu. Any other questions? All right. Okay, so let me actually demonstrate how we can schedule a non-medication task, and then probably Rahul can take over. So yeah, so to schedule a non-medication task, all we need to do is click on Add Task. here instead of medication, we select non-medication and we enter a title for the task. Now, yeah. So in the future, what we are planning, let's say a surgery is scheduled for the patient, right? Now, pre-surgery, there would be some certain task that has to be done for the patient. And the system would automatically generate those tasks. But right now, let me show you a manual of how we can do that.
Yeah.
Uh, maybe just let me come in for a minute.
Yeah, sure.
So for pre-surgery tasks, like, pre-anesthesia checkup needs to be done. There is a checklist for that. So in future, we should be able to, attach that checklist into the task so that, you click on that, it appears, the checklist appears on the screen and you can fulfill each one of them one by one. But that's not there right now in this first version. Over to you, Abhinav.
All right. Thanks, Akhil. So let me put a task as pre-anesthesia examination, and let me put it at 5:10. So I see that this task would get created over here. So let me go ahead and put two more tasks over here. Let's say something like prep area for surgery. Again, if I put this on the same time, this would come one after the other. And what this would look like, it would be kind of a pre-surgery checklist, right? So once you click on it, you would see certain n number of tasks that needs to be done prior to a surgery. And as soon as the nurse is doing them, they can also mark it as done and click on save. Yeah, as Akhil pointed out, right now this is a manual process. It's not automated yet. Any questions? All right.
Hello, can you hear me?
Yeah, hi John.
Yes. Okay. Thank you. Thank you so much. I think I just want to see how you create a new tax, which is not a medication tax, and then maybe show us how this is being administered by the nurse, and also how the medical doctors is able to check what the nurse has completed or not. Is it still in the same interface, or or is it in the patient dashboard? Thank you.
Right. All right. So let me take a scenario over here. Let me try to explain this with a scenario. Let's say the doctor is ordering a lab test for the patient, let's say CBC, right? And I'm clicking on save. Now, as a nurse, I'm coming into bed management, I'm coming into my patient, and I know that the doctor has placed a certain order for this patient. Right now, this might have been done in the night shift, and then tomorrow morning, I might need to take the patient to the lab. Now, what the nurse would do, right? I'm clicking on add task. I'm clicking on non-medication task, and I'm putting it as a task for the next shift nurse, right? Uh, take patient for lab sample, something like this. And I'm putting it as let's say tomorrow 7:59.
Or simply say draw blood sample for CBC.
For CBC. Right. Let me put this as for the time from now, 10, let's say 10 p.m. Once I do that, all the nurse needs to do is click on save. So here we would see that, sorry, did I click on save? Okay. So yeah, so the issue over here is the task is scheduled for 10 p.m. today. So I would not see it over here, but the next shift nurse, right? When they are on duty, they would see a task against them. They would see that, they need to take the patient for, CBC test. So that is the first part of it, how we are scheduling a non-medication task. Now, how do we complete the task, right? Again, to complete the task, we simply click on the task, and only when the time is due, right? Then we have the ability to mark it as done. Right now, we are still not at the, next shift. And I think this is also a configuration, up to what limit, time limit we want the nurses to be able to mark tasks as done and all. It has been disabled due to, safety issues raised by the client. Sometimes the nurse might end up by mistake, clicking on the medication which was meant for next shift and all. But yeah, once it is due, we can mark it as done and click on save. Let me actually do one thing. Let me actually create a task for now. Uh, test, and let's say 510. I click on save. I would see that there is a task against this patient. I'll click on the task. I'll mark this as done, and I'll click on save. Now, coming to the third part of the question, the first part was about how we schedule the task. The second one we showed how we, complete the task. The third one is about, how does the doctor know whether a task has been completed or not. Now this is again a bit tricky. We don't have a, perfect mechanism for it, but the answer is the doctor would again, look into this dashboard, come into the IPD page, and again use the same nursing task. Here, instead of all tasks, the doctor would, use completed. The doctor is interested in knowing what has been given to the patient, what has been done for the patient. Uh, Jean, does that answer the question?
Yes, that's fine. And maybe one thing, how if there is a tax that maybe the patient should pay something, how this is being linked to the payment of
All right. So, if I understood your question, if the patient has to pay for something, right? How is it linked? Okay. So right now, the straightforward answer is we don't have linking with the payment system. But Anshul, do you want to step in here? Talk about Udo, how we can do that? Yeah.
Yeah, I mean, any sort of a orderable, we expect like, the users to use the clinical module, go to the orders tab and do like, any sort of a order configuration and which will automatically flow over there. So you can, if you just can collapse, yeah. So see, right now there are three, but you can configure n number of order types over here. All right, you need to do certain configurations, but all that is possible. Say, for example, you want to counseling, for example, and counseling is potentially a paid for service, right? Or counseling, or whatever it is, right? Or even a minor procedure like say sutures or something. You can configure all this, and the doctor can come and order over here, right? And that will automatically reflect onto Odoo. If you want other sort of a things that directly from the, the IPD care view, that we'll have to, that we do not have right now, we'll have to see. Right now, we are not.
can you click on procedure order?
So Jean, this is also configurable. I mean, depending upon the hospital needs, all of these can be configured. Like Anshu mentioned, we can also add counseling orders and all.
Okay.
Yeah. So what you see
Okay.
here is just a sample.
Okay. Yeah, that's really necessary, and I think making sure that the tasks are being editable, this is actually very good. And for the procedure, this is what was really missing in the older version of Bahmni, because the medical doctors may request a lot of procedure to the patient, and sometimes we used to customize them directly in Odoo to make the patient being paid. But I think from the procedure orders, as you mentioned here, will be easy for the medical doctors to order some procedure to the patient, and it can pay them directly. And now, when it comes to the implementation of those procedures, it can be some of them can be implemented by doctors or maybe by the nurse. And then, but I think you show that for the nurse, we still need to record them as an editable text where they can order some tax. But that's fine. I think I have an answer for my question. Thank you.
All right, awesome. Yeah. Songju, you want me to cover the bookmark part? Yeah, I have showed it. I can also quickly touch again. So going again to the care view, in the general ward, there might be a lot of patients, right? Right now we have 7 patients, and as a nurse, I have some patients assigned to me. I would not be responsible for, caring for all of them, right? In a big ward, it might be around 50, 60, and so on. What I can do, I can simply bookmark some of the patients. Let's say I'm interested in this patient. I bookmark this patient, and my patient count increases to 4. Now, once I click on my patient, I would see only the patients who are actually assigned to me. Yeah, and I would see, what are the next set of tasks that are awaiting for them. I would also see notification if the doctor has prescribed some, medication for the patient and all, like we saw. I can also see, what was done in the last shift, what was missed and all, what's being scheduled for current shift and what's for next shift. Yeah. All right. Any questions? All right. So yeah, I'll talk about 2 enhancements and then I'll hand over to Rahul to demonstrate them. One was when the doctor is actually prescribing some medication, right? It's critical for the doctor to know the weight and height of the patient, especially in pediatric cases, and also the allergies of the patient, right? Now, here in the current screen, the problem we have is that, it is not very evident what allergy the patient might have, right? And the doctor might end up prescribing a penicillin, in which case, the patient is allergic to. So what we have done, we are, while prescribing, we would be able to show, the allergies as well as the nutritional values of the patient. And again, that is completely configurable. What you want to show over here is based on, the needs of the hospital. The other part that Rahul would be demonstrating is, if you remember, the nurse had actually, given a emergency medication to the patient and had also requested acknowledgement from the doctor. So we would see how the doctor receives this notification and how they can acknowledge it. All right. So I'll hand it over to Rahul now. Rahul, is that fine? Are you ready?
Sure.
Thanks.
Thanks, Adnan. I can share my screen. So,
This is
right,
Ashok here. Just had a quick question.
Sure.
See, a lot of the operations you're doing as Superman, right? I mean, for instance, when you said a nurse could assign patients and make it my patients, what privileges? I mean, if the patient has been somebody else's patient, you can't do that, right?
That's
Or
correct.
are the checks there? I mean, kind of a thing. So,
Yes.
I wish you could work as a nurse, as a user nurse, and see if those privileges and those, those messages come. Those preventions are adhered to you.
Right. Yeah, that's a good feedback and I'll keep note of it. Yeah, I apologize for it. We should have, actually configured a nurse with their relevant privileges and then done the demo. But for ease, we have used the super admin. But to answer your question, yeah, all of them are privilege driven. So depending upon what privileges is assigned to a, particular user, we would be able to control, some of the functions of it. I hope that answers.
Okay. Thanks.
Right. So I'll start off with what Abhinav just concluded. So one thing that the new the Bahmni standard release now has is that say I have a patient called Navneet Chaudhary who is admitted with high fever, and if I head over to consultation and I can see that the patient I haven't added much in here. So if you see I can add in a past I have added a past diagnosis for hay fever and fever with asthma. And in the medication tab, what I can see here is that I have the patient's vitals, nutritional values, and allergens are displayed here. This is purely driven by configuration, and this can be like most of the display controls that we have in the patient dashboard can also work in the medication tab. So if you wish to have the lab results or say the history and examination, or maybe even the observation forms, you can directly add it to the medication tab as well. So for that, you just have to head over to extensions inside clinical and add it over here under extensions param for billing and treatment. We'll be documenting all of that in our Bahmni Wiki, and you can head over to our Bahmni Wiki for more details of this. So this is one thing that the standard release would have. So the patient, the doctor, if I'm planning on adding a paracetamol, say, and I have these options to go with 500 mg or 650 mg. So I can see that this patient is an adult of weight 82 kgs and like of height 172. And I think a 650 would be needed for this patient. And I can go ahead and like add this. Right. Now once I hit save, this will get saved. And ideally, this should now be reflected on my IPD dashboard as well. So this patient has already been admitted and is part of my IPD visit. So now if I head over to IPD, I should see the patient medication. Okay, sorry. Since I'm a doctor, I'll have to like log out. I'll then maybe log out and show you as a super admin because in this case, this would give me some. I mean, this would let me switch between roles. So now as a super admin, if I go in and open the IPD visit for Navneet Chaudhary, I can see the diagnosis, the allergens, vitals, and also the treatment that Dr. Neha had provided. So the provider name now is Neha Anand. And now I can add the medication to the drug chart. So for that, what I can do is since it's scheduled twice a day, I can maybe start with say the time now it is 5. I can start with 5:30. Right. I don't have to add in any additional information. Just fill in a note. And with that, it'll get added to the drug chart. So for this schedule that we have between the shift that I have between 8 a.m. till 7 p.m., the medication that was administered for Navneet got added. And one other thing that we wanted to demo was the not medication. So this is also something that is behind config, totally driven by config. So earlier, I think Abhinav already discussed how you can add a non-medication task. There is also one other feature that we like to introduce, which is to group these tasks by a certain task type. So in this case, let me I have configured these two task types, which is an ADT task and in IPD patient care. So this patient, since this is the first time I'm checking in on this patient, Navneet Kumar Chaudhary. So what I'll do is I'll just add in medical collect medical history task. So this is something that that I should do on a ADT on an admission. So I'll just hit save and right. So now you can see that the patient collect patient medical history has been added as a non-medication task with the tag ADT task. So this would let you group tasks together. Right now we don't have the grouping filter enabled, but you'll for report keeping purpose or for your metadata, you can have a tag also associated. So I can now create something say against IPD care as well. So uh, and if I hit save, that will also get added. So now you can see that the tag is different. It is IPD patient care for for this task, and it is ADT task for the collect patient medical history. And one other thing that I would like to demonstrate would be the acknowledgement part from a provider. So if you see right now, maybe Navneet Chaudhary had a like was the fever was getting worse, and I need to administer a aspirin. So in that case, what I'll do is say I'll just administer paracetamol 550 mg. And in that case, I'll give it a dose of one with intravenous route, and I'll ask Neha for my acknowledgement. So I'll just add a note saying, right, and I'll save. It'll ask me for a confirmation. And now if I hit save, it'll get reflected here as not acknowledged. So the task has been created for the paracetamol, for the paracetamol 650 mg. It is marked as done because I have already requested 150 mg and I've requested acknowledgement from provider Neha. So I've marked it as done. So if I hit all task, you will see that the paracetamol 150 mg that has been administered, but it is not acknowledged. So for that, what I can do is I can step out of my role as Superman and log in as Dr. Neha. So here as Dr. Neha, if I go into clinical and I have this notification tab. So here inside notification, I can see that there is a acknowledgement request pending against Dr. Neha. So if I hit open, it says against Navneet Chaudhary, who is of age 14 male. There is a paracetamol 150 mg that has been administered on 31st of 7. So what I'll do is I'll just mark it as acknowledged. Right. Now if I hit acknowledge, it'll save this. And what I'll do is I'll just log out and log in back as Superman. Right. Now if I head over to Navneet Chaudhary and if I open the IPT dashboard, now you can see that the paracetamol 150 mg has been acknowledged by Dr. Neil. So that's the provider acknowledgement part. Any questions so far?
John has a question.
Right.
John, can you explain? I didn't catch your question. Dispensing from where? The medications.
Okay. Yes, thank you. I was just when you were presenting how he order medication, I remarked that when the patient still has clock ongoing, and when you want to dispense, to prescribe these drugs as well, it will flag and then it won't give you possibility to order these drugs. Maybe can you go back to the medication tab just to show you what that means? Yeah.
Sure. I'll just log out and log back in as Dr. Neha. So inside medication tab for Navneet Chaudhary.
Yes, medication. You see that you still have paracetamol that has been ordered for. Can you try to order again paracetamol?
Do you want me to refill or add a new paracetamol?
Maybe yes, order another one, but the same drugs.
Sure. I'm guessing it'll ask you for a confirmation in this case. So I'll just mark it as twice a day.
And then put the start date. The start date is put the start date maybe tomorrow. Yep.
Right.
Okay.
And
yes.
if I click on add, right. Now if I hit save, it is.
I think in August. Starting on July. Okay. I think that's fine. I thought that it was is going to flag out saying that the patient still has growths, it still has the same growths. I think
Right,
that's
but
okay.
That will flag
here,
out
if you
if
see,
the duration of both the orders overlap.
It was 1 day.
right.
Yeah.
Oh,
So
okay,
here it
okay.
says for a day, right? 31st of July for a day.
Oh, okay.
If you do it
So
again, 31st of July, it will overlap and then it will flag out.
Right. So
okay.
I can give clarify as well. 31st of July and duration is 1 day. And if I do a ad, now it gives me a pop-up. It gives me a warning saying that it's already
Yes,
administered.
exactly. Yeah. And then there is no possibility to force that.
I can revise and refill. That is maybe the right approach, I guess. Right, Arun. So in this case, it would be advised to refill or revise the earlier medication order rate.
Okay. Because in some
Yeah.
cases they want to give the same drugs during the same period. Maybe the patient can lose his drugs and then came back and he won't takes. Okay.
If the patient loses, the dispensed drugs and then you want to order again, are you talking about that case?
Yes.
Then you have to stop this order and order again so you can dispense again. And for stopping this, you have to, mention the reason that the patient lost, the dispensed medications.
Okay. I mean, this is how we used to do that. But I was just asking if there is no impact in the system for report generation, but it's fine. Okay. No, I mean that's okay. That's fine. Thank you.
Great. Thanks, Sean.
Yeah, sorry for that. I'm really expecting this new release. That's why I'm asking so much question.
No worries.
I'm
No worries.
running Bahmni in very, very, very big hospitals. Very,
Right.
very, very.
Thanks for asking these questions.
Rahul, if I can ask,
Sure.
when the doctor acknowledges the emergency medicine, is that the same doctor has to be there? Would there be any other provider can acknowledge?
No, it has to be against a particular doctor. So in this case, I log in as Superman and say for now, what I can do is I can prescribe another medication, which would be say I add this medication, which is tablet, an oral tablet, and I am asked to provide like give the provider's name in here. So this has to be acknowledged by Neha. That's the expectation. So this is marked against Neha, and right, this is marked against Neha, and this will be marked as none because it's an emergency medication, and I already administered it around right now. So I click save, and here in all, you'll get to see that I've administered the drug. And if I log back in as Neha, right, if now I log back in as Neha, in my notifications tab, I'll see that the same medication has been acknowledged. This will not be there for, say, Superman. I can log back in as Superman, and right now I am logged in as Superman, and under notifications, I don't have any medications to be acknowledged. So this is specifically needs to be acknowledged by Neha.
Thank you.
Great. Any other questions?
Yeah, we would also be looking forward to real life scenarios from the notification. Different places actually follow different sort of practices. for example, Rahul, if you can go to the medication administration.
Right.
Not here, under the care view. Right, so here, this is just an emergency medication, right? So we will be in future probably enhancing this. This is not just like, say, right now it is just done as an ad hoc one-time medication. In future, we would be allowing users to even schedule, drug to be given. Because often patients, for example, would come in where the particular drug, maybe they are diabetic, but they are not being cared for the diabetic in this episode. However, they will still declare, the nurse will probably verify from the doctor, hey, the patient is taking this medications, and the doctor will say yes, right, go ahead. That's one of the reasons also, like, you will notice that all the time, instruction from the hospital would be, please bring your current medications. OpenMRS doesn't have a model for medication statement, so we can't record it, but we can definitely schedule in our module, for example, a feature through which even non-ordered medications could be scheduled. Now, non-ordered medications, for example, probably needs some sort of an acknowledgement over here. Now, whether the acknowledgement needs to go as a notification or whether the nurse says, I've spoken over the phone by to the doctor and informed her, and she said, okay, maybe here we can directly say, hey, this doctor has acknowledged, right? And rather than a requested feature. So we'll be looking for feedbacks, real life feedbacks of this sort. Please keep providing us this sort of a actual real life use cases.
Sure, I'm sure. I think once we deploy, we'll get some feedback, or while demoing, we'll get some feedback.
Yeah.
Right. Any questions so far on the provider acknowledgement or on task types?
So, Rahul, what you demonstrated is there in the beta, or still getting to get in the next release?
Which one? The provider notification, Sandeep?
Yeah.
Right now, it is totally behind configuration, and we haven't added the configuration to our beta environment.
Okay.
So we have a wiki for that, and maybe you can refer to that and like try it out on your local.
All right. Thank you.
Sure. Right. I am guessing we don't have any questions. I'll stop sharing. Over to you, Abhinav.
Yeah, I think that was it from me as well. I'm happy to take any questions regarding any of the flows, any feedback as well.
Hello, can you hear me?
Yes, John.
Yes, another question was come out. Maybe when a doctor is consulting a patient and maybe give some instruction to the nurse, or maybe while he's been consulting the patient, can he ask for reference or for some guidance in the same hospital to doctors in the other services? Maybe can he share the patient information to him so that it can also help him to consult even within the same health facility?
Right.
I don't know if you get what I'm saying.
Yeah. Yeah. Understood. Yeah, so this is an interesting question, and also because we had discussions around this with our clients along internally as well. So what we are envisioning, right? The same way you saw notifications, we are thinking of expanding notifications into something called, doctor's dashboard, right? Where the doctor would be able to refer patients to other doctors internally, where the other doctor can, acknowledge that, okay, they have seen the patient being referred, and various other capabilities, right? So at this moment, no, but yeah, that is something we had on our roadmap as well, the ability to internally refer patients.
Actually, to some extent, you can already do that, right? There is you can create a custom disposition form or a referral form, for example, with the new metadata that you are doing. There is already a set called referral, I think. You can easily configure that, and uh, you can define a specific queue, which says that, like, hey, there is the incoming referral for the logged in doctor, and you should be able to see this information, right? If also using the disposition, you can also transfer potentially to different departments. That capabilities you already have.
Right. Thanks, Anshu. I'll share my screen and I'll show display what Anshu was mentioning. So John, there are two ways. One is, we can configure a queue over here. Let's say referred patients, right? And under that queue, we would see patients who have been referred to me. The other one is, we have this disposition here, right? Here we just have right now ADT features, but this can also be used for referral. Once you put a disposition type as a referral, and then you can configure a queue somewhere which shows all the patients that were referred. Anshu, correct me if I'm wrong.
Yeah.
Yes, thank you.
Sure. Try out the queues because these are extremely configurable and you can easily configure, referrals. All you need to do is configure the queue and create a simple form. All right. Any other questions? All right. I guess we're good then. All right. Thanks everyone for joining in. Mohan, is there something you would want to share? Any link to forms?
No, Abhiram, I think we have posted it already.
All right, cool.
Yeah, I just want to say that it's really appreciate everything, Chaku, because this was something been asked for many, especially the inpatient. We had very limited functionality in Bahmni, so this would certainly gives the Bahmni in hands of nursing staff to monitor it. We'll see what kind of feedback we get it, and we'll circle back. Thank you so much. Appreciate it.
Thanks, Sandeep. All right. I think we're good to close the session. Thanks everyone for joining in.
Thanks everybody
Sorry,
for joining.
when is the plan for the release?
You can